चलो Bismillahirrahmanirrahim. Dear elegant and ophthalmic team members and respected seniors, Assalamualaikum. I would like to welcome you all in the training session on dry eye and an ideal lubricant. We are extremely grateful and equally lucky to have with us Dr. Sameera Irfan, who will impart her knowledge with us. Let me give you all a little overview of the academic accolades of Dr. Sameera Irfan. She is FRCS Ophthalmology from Lahore, consultant pediatric ophthalmologist, strabismologist, oculoplastic surgeon, ocular surface disease specialist with 70 index publications, written 4 books on strabismus and oculoplastics. She is editor of the SAO Chronicle, which is official publication of SARC Association of Pediatric Ophthalmology and Strabismus. She is Vice President of Oculoplastic Society of South Asia. Madam received Gold Medal for Best Pediatric Ophthalmologist, Pakistan in 2014, SARC Excellence Award in 2018, Gold Medal for Excellence in Ophthalmology at India 2018, and recently she received Gold Medal for Research and Development in Pakistan 2019. We are very blessed to have her among us, and I would request all team members to gain as much knowledge from her in this session as possible. Thank you, Dr. Sameera Irfan. Mike is with you now.
Thank you so much, Dr. Ali. That was a lovely introduction, and I'm very glad and honored to be here, and very grateful to Dr. Rashid Bodla for arranging this meeting, and the whole team is here. I'm sure we can learn from each other. So there are 2 parts of the lecture. First is on dry eyes, and the second is on ideal lubricant. So, I mean, why we are arranging this lecture, that all these pharma companies, you have to promote your product and you have to sell them to the doctors who are sitting at the periphery, and you have to tell them what are the indications. Lubricant is not only needed in a dry eye patient. There are so many conditions which I will tell you where it's required. It is necessary. And if you know it, of course, you can promote it well. So let's start with the first part. Let's share my screen. Screen share. अच्छा, इस पे आ रहा है जी कि होस्ट डिसेबल्ड अटेंडी स्क्रीनिंग स्क्रीन शेयर, तो ये एनेबल करें आप. Dr. Ali?
Ji.
I can't share my screen.
Daniel, ये screen basically Daniel is hosting from the head office right now.
जी, तो उन्हें क्या वो enable करें, तो फिर I can share.
Daniel, कैसे किया? ये share. इसको कैसे बोलूं?
मैम इनेबल होंगे, आप करके देख लें.
जी जी हो गई है. शेयर. ठीक है, अब आ रही है आपको नजर?
जी मैम.
ठीक है. So why does an eye need lubricants? Well, you have to understand that all body tissues, they contain they're made up of 80% water, but they are protected by the skin. And our skin, when we are exposed to the atmosphere, it has got this thick layer of keratin. And this keratin, this prevents the water from the cells to evaporate and get lost. So all these cells, they can function properly. But in the end, in addition, the skin is supplied by blood vessels, and that keeps on supplying nutrients and water to skin, and skin keeps its function. On the other hand, the cornea. Cornea is the only structure in the body that is devoid of keratin. It has no keratin and it has no blood vessels. So no keratin, so how is it protected? It is exposed all the time while we are looking out. While the eyes are open, we're all the time exposed to all kinds of atmosphere. And without the keratin, the cells are going to get dry and they are going to lose their function. So Allah Ta'ala, He has blessed us with the tear film. So the tear film keeps this corneal epithelium moist all the time, so it can function. Another important difference from other body structures is that cornea does not have blood vessels. A cornea is a rapidly multiplying tissue. A healing and dryness, whenever there is a cell loss, the corneal epithelium heals from these basal cells. So how does it meet its metabolic requirement? And this is again by virtue of the tear film that gives its oxygen, glucose, proteins that are required for cell synthesis. So coming to the, now that's another diagram which will make you understand better that sun's rays, this is a cell which is mostly water. And when this it is exposed, then water can get absorbed. But because of this thick layer of keratin on the skin, we are protected. On the other hand, cornea, this is the tear film, and this thick tear film, it protects the underlying corneal epithelial cells from drying. And in addition, the cornea, this tear film provides all these important ingredients, glucose, all these electrolytes, and oxygen, so that this rapidly multiplying epithelium can heal. When there is the tear film is absent or reduced, all these electrolytes are still there, but the tear film is reduced and it gets evaporated. So the tear film gets hyperosmolar. All these electrolytes which are present in the tear film, they get concentrated. So the tear film osmolarity increases. When the osmolarity increases, water inside the corneal cell, it moves out into the scanty tear film that's there. The cell shrinks and keeps on shrinking, and ultimately it dies. So that's what happens. Hyperosmolar tear film, water leaks out of these cells and the cells shrink and they die, unless we replace this tear film. So this healthy tear film, it's got these oxygen, glucose, nutrients, protein, and very important growth factors. And these growth factors, these keep the cornea healthy. And the cornea is then a polished surface, so we can see clearly. And all these growth factors and nutrients are supplied so it can heal. And the other third important function is that it prevents virus, bacteria, fungi from attacking the cornea. As long as the tear film is there, all these bugs, they cannot attack the cornea. They will be washed away from the eye and they cannot adhere, or they can penetrate the cornea and ulcer cannot produce. So it's so important.
Okay.
And the tear film, now it's got 3 layers. When you are giving a lubricant, you are replacing only the water. That water cannot stay on the cornea. It will not wet the cornea. It's like the cornea, a dry cornea is like a rock. A rock, अब ये जो एक चट्टान है, उसके ऊपर जितनी मर्जी बारिश पड़े, वो चट्टान वेट हो सकती है, मॉइस्ट हो सकती है, वो बारिश उसमें से फिसलती हुई गुजर जाएगी. Similarly, when you are giving lubricants on a dry eye, on a dry cornea, that lubricant will not stay on the cornea. Why? Because nature has made the cornea hydrophobic. Hydrophobic means it's water repellent. It repels all the water. So what makes it water loving so that water stays on it? It's the mucin layer, mucin glycocalyx layer. And once an epithelial cell dies, this mucin glycocalyx layer is absent at that site. So even if you are giving lubricants, and if there is an ulcer here or epithelial loss, that lubricant will not wet this lost epithelial cell. And if this lost epithelial cell is not replaced, your lubricant will not have any effect on this cornea. The erosion or the ulcer will not heal. In the absence of growth factors, this ulcer is not going to heal, or the area where the epithelium is lost, because you're only supplying liquid. You're only replacing the aqueous component, but there is no mucin there. And similarly, lipids, they are extremely important, that in between blinks, the tear film thins out. When an eye blinks or closes, the upper lid picks up the tear film from the lower lid, spreads it over the cornea, but in between blinks, the tear film thins out. And when it thins out, then it is the lipid that prevents this thinning in between blinks. So there is no dry spot in between blinks. As soon as a dry spot forms, then the nerve impulses, they go to the brain, because cornea is the most richly supplied organ. Cornea has 2 million nerve endings. And as soon as one dry spot forms on the cornea, impulses go to the brain, and all three components of the tear film are released. So this yellow is the corneal epithelium. This green is the mucin layer, and this mucin layer, this makes the aqueous layer stabilize on the tear film. So this point is very important to keep in mind, because your optes is helping replace this mucin. So I'm sure none of you would know that. Without this mucin, tear film or any lubricant cannot moisten this cornea where the epithelium is lost. Because cornea is like this brickwork, and this brickwork is very, very tight, so nothing can enter, no bacteria, no fluid can enter, and the cornea can remain clear. So what happens in dry eye, this clear, smooth, polished cornea, it becomes like this. It loses its clarity, its luster, it becomes cracked, like a banjar ye zameen hai, on which there is no rainfall. The cornea becomes just like this. It loses its function. Now bacteria, viruses, anything can attack it, and it can develop disease. It's like your dirty windshield on which there is so much dust, or when there is too much rain, you cannot see. So the cornea loses its clarity and loses function. And you get patients with so many problems. And all these bacteria, then they can attack, they can land on such an eye, and the eye loses its function. So loss of tear film predisposes to disease, and treatment of disease or infection with antibiotics or whatever drugs you give, and they are with preservatives, they are further going to aggravate tear film instability and dry eyes. So it's a vicious cycle. So I hope you get the idea that at any disease, wherever you are or your doctors are giving any kind of medication, that medication, if it's given for more than 2 weeks in any eye, it's going to cause tear film instability. And I will tell you in a minute why. And when there is tear film instability, Any anti-allergic drops, steroids, or antibiotics that the doctor has given to any patient for any reason, that patient will develop instability of the tear film, loss of the tear film, and then such a patient must need lubricant. So lubricants, the use is not only limited to dry eyes, it is indicated in any condition where the patient is using any eye drop for more than 10 days or 2 weeks, because the tear film becomes unstable in that condition. So dry eye can occur at any age. People mostly think it's a disease of the old age. No, it can occur even in children. Any child who has developed chronic allergies are common in children. Any viral conjunctivitis, most common in children. So they all develop dry eyes because of the disease, number one, disease process itself, because any kind of conjunctivitis, it is affecting the production of mucin from the conjunctival goblet cells. Any disease of conjunctiva will affect the tear film because of lack of mucin. And I hope you understand how important mucin is. Without the mucin, your lubricants will not work. Without the mucin, the disease is going to get worse. And in any disease, if there is loss of mucin, the course is downhill. So you have to replace the mucin. So any patient who is working outdoors, farmers, any indoor workers, drivers, especially who are driving without goggles, name saab, main aapko keh ke thak gayi. So all the drivers, farmers, indoor workers. Why indoor workers? Because they are working in air-conditioned environment. Air conditioning results in loss of humidity inside the eye. So inside the room, and when there is a dry environment indoors, all this air conditioning, it will not only cause dry eye, it will worsen any patient who has dry eyes. So all these bankers, IT workers, all these long-term screen users, they suffer from this problem. All the time they have irritable eyes, headaches, eye strain, and they don't know what to do. Ultimately, they end up with blepharospasm. Why does blepharospasm occur? Why is this the end stage of dry eye? Because when a person is developing 1 or 2 spots on the cornea, the natural tendency is to blink. They start blinking more and more. And we are doing a study in which we are now measuring the blink rate of any person who walks in the clinic. Any person who walks in the clinic and has like this, blinking too much, and then we test for dry eye, it's all positive, whether that patient is symptomatic or not. So the blink rate, any person who starts to blink more than say 8 times per minute, that person is heading into dry eyes. 8 to 10 times is zyada jiska blink rate hai. If you check the tear film breakup time, Schirmer's and mucin staining, that person has dry eyes. So this is the earliest sign, earliest symptom, increased blink rate. And then that increased blinking is an attempt by the patient to spread the tear film on the cornea. And then it ends up, this is the end stage, blepharospasm. So computer vision syndrome, very, very common these days. Every person is on computers. It's bacha or bada or buda, every age group. So what is this computer screen doing? When you are reading, you forget to blink. Every person, you forget to blink because you are trying to read, you are trying to focus. And when you don't blink for say 10 seconds, the dry spots, they form on the cornea. Because when you blink, the upper lid comes down, it picks up the tear film from the lower lid and spreads on the cornea. But you're not blinking, the eyes open, constantly open, the tear film thins out and dry spots come on the cornea. And those dry spots, if they stay dry, then the cells die, the epithelium dies there, and ultimately the condition gets worse and worse if this is not remedied. So all these people, they must be given lubricants. They are the mildest, they have the mildest form of dry eye, and they can be really helped if they have lubricant in their offices, in their drawers. They can, every hour, they need to instill a drop of lubricant or 2 hours so to work comfortably. Similarly, children, they complain of these dry burning eyes while they're reading, staring at screens all the time. And then they have bad postures. So the eyes with our constant screen usage become irritable. And this is a very important indication to supplement with lubricants, and they help a lot in this. So I'm actually telling you all the indications where you can tell your doctors that these are the conditions in which lubricants should be prescribed in addition to the basic cause, basic problem. Any surgery, why patients come to me after cataract surgery. Madam, we had surgery. After that, the vision is blurred. We have misty vision. We cannot see properly. And then they come to me for a second opinion. Surgery has been done by anyone. So you look at I look at the surgery, the lens perfect, vision otherwise is fine. What they have is dry eye. How does cataract surgery precipitate dry eye? Because even the tiniest of incision, it cuts the corneal nerves in that area. Then all the medication that is given pre-op and all the eye drops that are given pre-op, so before surgery. Number 3, during surgery, all the manipulation, all the eye drops that we have been given to keep the pupil dilated, and then whatever kind of eye drops that are used during surgery. And then post-op, for 6 weeks, they are on eye drops. And all these eye drops, they have preservatives. So the corneal nerves are cut at that area, which lead to loss or cause tear film instability. And then all these medications, pre-op, intra-op, and post-op, they result in precipitating dry eye in such patients who didn't have any symptoms beforehand because the balance was maintained beforehand. But surgery, perfect surgery, it has disturbed this balance. And then you give them lubricants and they're happy. Autoimmune diseases, very, very common. Thyroid eye disease, rheumatoid arthritis, they, of course, lacrimal gland, it gets destroyed and they develop dry eyes. Any viral infection, adenoviral keratitis, especially during epidemic, very common. These adenoviral keratitis, if you only give lubricants, acute adenoviral will never go into the stage where it develops keratitis. Only treatment for this epidemic pink eye is lubricants, nothing else. But doctors, they are giving steroids, they are giving antibiotics unnecessarily. Antibiotics have no role in viral infection. Why to give? They, when you're giving antibiotic and steroids, they are precipitating, they are promoting the development of this keratitis. And once this keratitis develops, it goes on for years. And patient, they have very irritable eyes. And then they need lubricants as well as tacrolimus for 2-3 years. Diabetes, a very, very important cause of, because it reduces all these it damages the corneal nerves. Diabetes, it causes the less tear production, aqueous production is reduced, Meibomian gland dysfunction is induced. So diabetes, any patient who's diabetic and who is going for surgery, I tell my trainees, you have to give them lubricants post-op. You have to start them initially, before even surgery, you have to start them. Any diabetic patient going for any surgery, you have to give lubricants. Then any injury or corneal ulcer. In injury and corneal ulcer, injury, of course, corneal nerves are damaged. So you have to supplement with lubricants. And corneal ulcer, the patient is going to be on antibiotics for a long, long time. So all these antibiotics, they are damaging the surface of the cornea even more. And unless you supplement the tear film, this cornea is not going to heal. That is why we have so many non-healing corneal ulcers. Then contact lenses. All contact lens wearers, they need lubricants. Chemical burn, because of course, chemical injury, it destroys all the glands and there is loss of tear film. Then Stevens-Johnson syndrome is getting very common in children, in young people. They have an antibiotic for any infection, any fever, and then they end up with these red eyes where there is total loss of conjunctiva, and there is loss of Meibomian glands. And they have severe, severe dry eyes for the rest of their life, and a major indication that they need help. So contact lens is very important, a cause of dry eyes, because a contact lens, when it sits on the cornea, it splits up the tear film. So there is tiny bit of tear film which is between the contact lens and the cornea, and then there is a portion which is in front of the contact lens. This tear film, it evaporates very rapidly, and especially patients who go to sleep with contact lenses, extended wear contact lenses. Cornea gets damaged during sleep because this tear film gets absorbed. And then the contact lens is directly sitting on the corneal epithelium and causing hypoxia. And this hypoxia then results in all these erosions. And when they come to the doctors, there is all this damaged cornea. And so it's the job of doctors, as well as, anyone who is wearing contact lenses, that we have to educate to remove these contact lenses at night, whether they are extended wear or not. They should never sleep with the contact lenses on, and they need lubricants. Then all these kind of conjunctivitis, bacterial, viral, what they do is they inflame the lining, the conjunctival lining. So this conjunctival lining is not producing healthy mucin. It is a toxic mucin. And if the mucin is toxic, how can the tear film, the aqueous layer, stabilize on the cornea? This toxic mucin will precipitate and form those mucus strands in the eye, and that mucin is lost. So they need, in addition to the treatment for viral conjunctivitis, as well as this VKC or any allergic conjunctivitis, in addition to the anti-allergic drugs, they must be given lubricants. That's a big must. So you are the pharmacist, you are you have more approach to the general ophthalmologists which are sitting in the districts, and you can tell them that, doctor, in addition to the anti-allergic drugs, you have to prescribe them lubricants if you want to make your patients better. Then blepharitis, lice, Ectropion, all these conditions, in addition to treating the basic cause, they need to have lubricants. Many people, normal people, they have eyes which don't close at night fully. They have leg ophthalmos. The eyes stay slightly open during the night. And while they are open, they are exposed. At night, blinking is absent. So the tear film, it does not spread on the cornea. So whatever area is exposed, it develops these erosions or ulcers, and they have irritable eyes. So these patients must be prescribed lubricant ointment at night. Must. Any patient with Ectropion, because this lid is damaged, the tear film is usually here in the lower meniscus. Even if the upper lid now closes on the lower lid is hanging down. How can it pick it up? So lubricant is the first treatment in this patient till this patient has surgery to release the scar. Meibomian gland dysfunction, every normal person after the age of 40 is developing Meibomian gland dysfunction. Every person. And why? Because these Meibomian glands, their health is maintained by a tiny amount of androgens that is produced in the body. After the age of 40, females, they have a sharp decline in androgens. Males, after the age of 50, the androgens start reducing. So this meibum, instead of this clear droplets, clear oil droplets, it becomes thick, viscid, like cheese or like this wax, and it cannot coat the surface of the aqueous film. The aqueous then absorbs and the tear film is unstable. So So Meibomian gland dysfunction is an extremely important cause of dry eyes, and every person, every normal person then needs a treatment of this Meibomian gland dysfunction along with lubricants. And this has to be assessed in every normal person, especially in cataract patients. So, I mean, they are in their 60s or 70s. It's a must. They all have this cheesy, thick Meibomian gland block ducts. And unless these patients are treated preoperatively, patients who are going for LASIK, any refractive surgery, it's a must. They should be diagnosed with this Meibomian gland dysfunction and treated before they can have the LASIK. Otherwise, and also in LASIK, I was talking to many refractive surgeons, and they prescribe lubricants only for 15 days. Corneal nerves do not grow for 6 months. They don't grow for 6 months. So if all these surgeons, I mean, you have to tell them that please give your patients, LASIK patients, lubricants for minimum of 6 months, not less than that. In 2 weeks, no nerve heals. Corneal nerves never heal in 2 weeks. Facial paralysis, very common cause. This face is all sagging down. Eyelids don't close. So at night, as well as during the day, they need lubricants till this facial palsy is corrected either surgically or they recover on their own. A very important cause or indication for preventing this developing corneal ulcer on a patient of facial palsy. So they must be given lubricants. Then when there is alkali burn, acid burn, or chronic conjunctivitis, there is loss of conjunctival mucin and loss of tear film, and there is loss of these limbal stem cells. This is the limbus of the cornea and conjunctiva. This is the limbal area. From the limbal area, these cells, they migrate and they help in healing of any corneal ulcer or any corneal erosion. So all these patients who have these problems, or they are on any medication like glaucoma patients who are on long-term anti-glaucoma therapy, they develop limbal stem cell deficiency. And if they, God forbid, all these glaucoma patient develops an ulcer, it's not going to heal. They already have so much problems with their tear film, it never heals. They have these epithelial defects or all this loss of corneal function by these vascularized fronds growing over the cornea. So principles of therapy, or any therapy, any eye therapy, you have to tell your doctors out there sitting in the periphery that in addition to diagnosing the basic cause, they have to diagnose whether this patient has a tear film instability by staining the cornea, conjunctiva with the fluorescein, measuring the the breakup time, and doing the Schirmer's test. And all these patients who are going to have eye drops prescribed, any kind of eye drops prescribed for more than 2 weeks, they should be given lubricants to replace or restore the tear film. Dry eyes and inflammatory disease, only restoring the tear film with lubricant will not help when it becomes from mild to moderate or severe. Mild dry eye, you can get away with only lubricants. But moderate to severe, you have to give an anti-inflammatory agent, because it's not only a chemical inflammation by hyperosmolarity, as I've explained to you, there are inflammatory mediators. So anti-inflammatory agent is a must. Dry eye treatment is not complete without anti-inflammatory agents. And what are those anti-inflammatory agents? So level 1, I'll tell you in the level 2 and 3, you need anti-inflammatory agents. In level 1, in addition to the lubricants, you have to do environmental and dietary modification. Environmental modification, what it is? You should have humidifiers in the air-conditioned rooms. Every person who is working on the computer screens must take a rest for 5 minutes after every 40 minutes. That's a must. so that the tear film is replaced and all the eye strain in the muscle in the back is avoided. Then computer screen should be a little bit on the lower level so that the eyes are not fully open. Full eye level, it shouldn't be, or higher, it should be a little bit lower, but not like this that causes eye strain in your neck and chronic strain in the neck muscles. Sun protection is a must, particularly for drivers or when you're going out. A balanced diet with adequate hydration, drinking 8 to 12 glasses of water every day. This is a must for every person to avoid dry eyes. Vitamin D3 is a very important supplement to avoid or control dry eyes. Flaxseed and smoking. Smoke irritates the eye, and in already person who has a dry eye, it will further reduce the tear film and cause instability. All patients who are on topical beta blockers, antihistamines, anti-glaucoma therapy, they have to be warned that they are likely to develop dry eyes, so they must be given lubricants. Even oral antihistamines and oral beta blockers for hypertension, allergies, they must be given lubricants. Avoid contact lenses in these patients who are already developing minimal dry eyes, and treat the cause, and in addition, lubricants. And then eyelid therapy, because even if in mild cases, Meibomian gland dysfunction is there. So you have to give hot fomentation, lid scrubs with baby shampoo, massaging the eyelids, lower eyelid upward and upper eyelid downwards to establish the flow, and topical tetracycline. So there are many ways to do this hot fomentation because it's everybody's problem. So we all need to know how to control it. Number one is to do exercises, eye exercises, squeezing the eyes 5-10 times, especially in the morning. When we are asleep, there is stasis of the secretion. All these glands, they are running like this. So during sleep, there is stasis of all the meibum. Meibum just piles up here. And if you squeeze 10 times and then wash the eyes, the meibum flow is established. And then these hot fomentation with hot water and hot towels or like this, then it helps control the Meibomian gland dysfunction and flow. So anti-inflammatory therapy is a must because rainfall cannot make a rock wet, as I just explained. Lubricants alone will not moisten a hydrophobic cornea. So when the level of dry eye is from 1 to 2 or 3, anti-inflammatory drugs are a must in the form of cyclosporin, tacrolimus, tetracycline, acetylcysteine, and diclofenac. So a healthy tear film, it is essential for normal functioning of the eye and perfect vision. Any ocular problem that requires any kind of eye drops for more than 2 weeks results in a dry eye. And it affects all 3 layers of the tear film. So the management approach for dry eye is graded and stepwise and long-term. Lubricants alone will only help in a mild dry eye, but in moderate to severe, you have to add anti-inflammatory therapy. So that finishes the first part of the lecture. Any questions on this? Anji, any questions?
जी नजीब साहब कोई क्वेश्चन?
Thank you very much, Dr. Sameera, for very conspicuous and detailed presentation. What we perceived during this presentation that everybody needs at certain stage a lubricant. But I want to clear myself that we can do, use this our Opthes drug, a problem with the corneal epithelium cells only, or we can use in a normal eyes as well.
This I will explain in this next lecture, because Opthes is a drug that has a mucinomimetic property. It's got a bit of mucin. Problem is with mucin. Any eye disease, if you're not replacing the mucin, you're not helping the patient. But your drug Optis, it's good, and I'm sure none of you know about it. So I had to tell you. That's coming up in the next lecture.
Thank you.
Anything else?
Anything else?
No, thanks.
Okay, so we can go on to the ideal lubricant. Okay, so what is an ideal lubricant? Fortunately or unfortunately, there is none. So ideal lubricant वो है जी जो कि mimic करे tear film को, जिसमें कि तीनों चीजें होनी चाहिए, लिपिड भी होना चाहिए, एक्वस भी होना चाहिए और म्यूसिन भी होना चाहिए. That is an ideal lubricant. और फिर tear film में nutrients हैं, उसमें growth factors हैं which support the growth of the cornea and the nerves. None of the lubricants which are commercially available have these. So unfortunately, commercial kuch nahi hai. The only thing which mimics a tear film are the autologous serum. So koi bhi patient which has worsened because in spite of lubricants, autologous serum has to be given. उसके अलावा वो ठीक हो ही नहीं सकता. Dry eye ठीक हो ही नहीं सकती without autologous serum. So that is the perfect lubricant. But short of that, we'll see what other lubricants are there. So an ideal lubricant, why do we need a lubricant? Because it has to lubricate the cornea and keep the ocular surface moist and shiny in between blinks. It reduces friction between the eyelid and the cornea. Eyelid is rubbing on the cornea all the time. So this friction has to be reduced. If there is no tear film, the eyelids, they are going to damage the cornea. Then the tear film, it cleanses, it removes carbon dioxide, it bugs, koi bhi foreign body hai, remove the waste from the cornea. And that ideal lubricant should nourish. Nourish mein kya hai ji? Oxygen. Oxygen dissolves from the air into the lubricant and then enters the cornea. Oxygen cannot directly enter the cornea. So oxygen has to go through water and then enter the cornea. So ideal lubricant provides oxygen. It washes away the carbon dioxide and any engulfed bugs. But for that purpose, the ideal lubricant should stay on the cornea. It should be there all the time. आप मुझे अब नेक्स्ट स्लाइड पे जाने से पहले कैन एनीवन ऑफ यू टेल मी कि जी आपका जो आइडियल ल्यूब्रिकेंट है कितनी देर कॉर्निया के ऊपर रहता है? एनीवन? कितने मिनट रहता है या कितने घंटे? विच इज इम्पॉसिबल. कितने मिनट रहता है? राजेश साहब बताएं ना जरा, ल्यूब्रिकेंट कितनी देर रहेगा आंख के ऊपर? अपना माइक खोल लें.
Dr. Ali,
I believe till the next blink only.
नेक्स्ट ब्लिंक 8वें सेकंड पे है. आपके ख्याल में एक ल्यूब्रिकेंट 8 सेकंड रहता है आंख पे?
नहीं, I am being loyal to my product.
Can't. Anyone? अच्छा मुझे ये बताएं, when you are promoting your lubricant to your doctors, आप क्या कहते हैं जी, एक lubricant कितने घंटे बाद डालना चाहिए आंख में? What do you tell them?
Doctor, this should be probably hourly.
Severity of the dry eye.
Doctor,
Severity of dry eye.
it should be hourly.
Okay, how many of you honestly tell your doctors कि जी hourly होना चाहिए? I doubt that.
Doctor Ali, आप अपनी जो ट्रेनिंग में इनको कितना बता रहे हैं अपनी फील्ड फोर्स को?
सर हमने इनको 1 to 2 hourly कहते हैं कि, but again it depends upon the consultant and doctors themselves के how they perceive the severity of the symptom.
अच्छा,
Actually, Dr. Sameera here, Dr. Sameera, actually, what is happening with us and with the ophthalmologists in general in Pakistan, they probably are not good as you used to see your dry eye patients. Sometimes they used to prescribe it 4 times in a day, 6 times in a day. But still, I understand once I have been with you in of these presentation, and you advised all of your ophthalmologists to give it to your patients early, at least.
So the retention time of a product is from, I'll tell you, I have figures, is only 30 to 45 seconds. 45 सेकंड बाद वो आई ड्रॉप निकल जाता है आंख से. Okay. So an ideal lubricant, another important point is that it should not cause any toxicity. That is the ideal lubricant. अगर आपका lubricant ही toxicity कर रहा है, how come it's an ideal lubricant? It cannot be. So there are many products जिनमें के ये preservatives हैं. अब मुझे ये बताएं, आप मेरे पास आते हैं आपके बच्चे, उनको ये भी नहीं पता कि जी प्रिजर्वेटिव क्यों डाल रहे हैं हम एक आई ड्रॉप पे. एक आई ड्रॉप जो है उसमें नंबर 1 इज एक्टिव इंग्रेडिएंट, नंबर 2 इज द प्रिजर्वेटिव. व्हाई डू वी ऐड द प्रिजर्वेटिव? जरा आप जवाब दें मुझे. डॉक्टर अली, ये बताया हुआ इनको आपने? नोबडी नोज व्हाट इज प्रिजर्वेटिव डूइंग इन दैट बॉटल. व्हाई डू वी पुट देम इन? वो कहते हैं जी शेल्फ लाइफ बढ़ा रहे हैं. कैसे? व्हाट्स द मैकेनिज्म ऑफ इंक्रीजिंग शेल्फ लाइफ? जवाब no one.
Madam,
why are
unmute है.
For increasing shelf life.
how हंस गए
मैम. जो मेरी थोड़ी सी अंडरस्टैंडिंग है, मैं आई बिलीव के बिकॉज द इंग्रेडिएंट्स आर ऑल केमिकल्स, तो दे इंटरेक्ट विद ईच अदर, सो प्रिजर्वेटिव बेसिकली कीप दैट
जो केमिकल इंग्रेडिएंट्स आपस में नहीं लड़ाना, वो दोज आर बफरिंग एजेंट्स, स्टेबलाइजिंग एजेंट्स. प्रिजर्वेटिव क्या कर रहा है?
It preserves from contamination.
How? How does a preservative prevent contamination? हो कैसे रही है? एक बॉटल है, वो बंद है, महीना बंद शेल्फ पे पड़ी हुई है, उसमें कंटेमिनेशन कैसे हो रही है?
From atmosphere when open.
तो प्रिजर्वेटिव वो उसको कैसे प्रिवेंट कर रहा है? वो क्या कर रहा है उसको?
मैम आप
See, it's such an important lecture. अब ये जितने आपके बच्चे हॉल में बैठे हैं ना, उनको के अंदर ध्यान से सुने, इधर उधर ना जाए, फोन भी बंद कर दें, बिकॉज दिस इज द मोस्ट इम्पोर्टेंट टॉपिक. और ये अगली दफा जब मेरे क्लिनिक में आएंगे ना, तो मैंने पूछना है इनसे, और जिसको नहीं पता होगा ना, मैंने उसको निकाल देना है. तो ये जो बैठे हैं ना, उनके अंदर ध्यान से सुने. उनका इम्तिहान होना है. अच्छा जी, सो जो प्रिजर्वेटिव है, द प्रिजर्वेटिव फ्री इज एन आइडियल लुब्रिकेंट, बिकॉज प्रिजर्वेटिव जो भी हैं, दे आर कॉजिंग टॉक्सिसिटी इन द आई, एंड आई विल टेल यू हाउ. अच्छा, जो आइडियल लुब्रिकेंट है, इट शुड स्टे ऑन द कॉर्निया फॉर अ लॉन्ग टाइम. इट शुड रिस्टोर ऑल 3 लेयर्स. वो तो पॉसिबल ही नहीं है, क्योंकि ना उसमें लिपिड होता है, ना उसमें म्यूसिन होती है. सो इट्स ओनली एक्वस दैट इज बीइंग रिप्लेस्ड. It should provide nutrients. Glucose किसी में होती है, किसी में नहीं होती, and some have these electrolytes, which is a good thing. Addition of electrolytes is a good thing. Osmo protection. अब dry eye मैंने आपको बताया कि जी ये hyperosmolar condition है. अब hyperosmolar एक environment है, तो उसमें जो है जो cells हैं वो shrink हो गए हैं. अब जो ऑस्मो प्रोटेक्टर्स हैं, ये होते हैं, ये 3 तरह के इंग्रेडिएंट्स हैं. वो अगर हो एक lubricant में, so that lubricant is the perfect lubricant जिसमें osmo protector भी हैं, और अगर उसमें क्योंकि वो maintain करते हैं goblet cell count. Osmo protectors, if they are added to a lubricant, they promote the health of goblet cells, और glycogen उसको भी maintain करते हैं, और cells को, as I told you, they shrink because of loss of tear film. तो वो जो shrinking cells हैं उनको वापस अपने size पे ले आते हैं, अपनी normal functioning पे. So osmo protection is an extremely important part. और ये आपके जो बाहर की products हैं वहाँ international allergen की उसमें osmo protectors added हैं, not in the products which are available in Pakistan, which is very bad. हम third world बेचारे हैं वो उनको osmo protector ही नहीं दे रहे. So not bad. और फिर जो ideal lubricant है उसका neutral pH होना चाहिए. Why? Because जो एक dry eye है उसमें there is all the time oxygen use हो रही है और carbon dioxide release हो रही है एक cell में से. वो carbon dioxide is normally washed off by the tear film. But in dry eye, the carbon dioxide, it stays there. It makes the pH of the eye acidic. वो pH जो है acidic जो है, normal pH is around 7.5 एक अंक का, alkaline होता है. But in a dry eye, the pH becomes about 6 to 6.5. It's very acidic because the carbon dioxide is not removed from the eye. Okay. So what happens next? So topical medication, as I said, it's got an active ingredient and it has preservative. अब preservatives क्या करते हैं कि जी कोई भी bottle है, how does it prevent contamination? It prevents contamination because it is, जब हम खोलते हैं तो it does touch the eyelashes, it is exposed to the environment, and environment has got all kinds of bacteria, and those bacteria जब आप press करते हैं bottle को या नहीं भी करते, तो वो जब release होती है, a little bit of air goes in the bottle and it contaminates, वो touch भी कर रही है eyelashes को जहाँ पे सारे bugs हैं. So that preservative, it not only kills those bugs, it also अब वो bugs को kill कर रहा है, यानी कि bugs भी living cells हैं. तो वही जो mechanism है वो उस cornea को भी damage कर रहा है. So these preservatives, they are added to increase the shelf life by killing all these bacteria, viruses, fungi, prevent them from growing. Number two, ये जितनी भी drugs हैं, ये मैंने आपको बताया कि जी tear film है आंख के ऊपर जिसमें 3 layers हैं, liquid है, वो सबसे ऊपर lipid layer है, फिर aqueous है, फिर mucin है, और उसके बाद जो cornea का structure है, it's like a brickwork. ये brickwork ऐसे tight है, इस tight brickwork के दरमियान cement substance है. That cement that prevents the penetration of a drug into the cornea, into the aqueous chamber. अब drug penetration हम कैसे enhance करें? जितने भी एंटी ग्लाकोमा ड्रग है या एंटीबायोटिक है उसमें तो आंख के अगर अंदर जाना है तो वो कैसे जाएगी? वो ऐसे जाएगी कि ये जो चैनल्स, ये जो सीमेंट सब्सटेंस है, ये प्रिजर्वेटिव उसको डिस्ट्रॉय कर देगा. These preservatives, they destroy the cement substance. So the cells have these gaps. ये आपको नजर आ रहे हैं ये जो channels हैं इस diagram में. So the drug can go through these tight junctions into these gap junctions, reach the cornea, reach the aqueous. और सबसे ज़्यादा जो destroy करता है ये cement substance, that is benzalkonium chloride. सबसे toxic वो है, और जितनी ज़्यादा उसकी concentration होती है in an eye drop, वो उतनी ही ज़्यादा toxicity करता है. जितनी ज़्यादा concentration होती है उतनी ज़्यादा drug penetration होती है. So जितनी anti-glaucoma medication है, they have a high concentration of BAC because to enhance its drug penetration into the aqueous chamber. But at the same time, BAC is destroying these tight junctions on the cornea. It is destroying the lipid layer of the tear film. By destroying the lipid layer of the tear film, it can enter the cornea. Lipid layer as well as the tight junctions, as well as the cement substance in between the cells. So all these three things, they are destroyed by BAC, and that's how it increases its penetration and reaches the cornea as well as the anterior chamber. So the bioavailability of the active ingredient or the active drug, it depends whether it is hydrophilic or lipophilic. अब ये जो lipophilic है, the cell membrane, एक जो cell membrane है, that is lipid से बनी हुई है. So जो lipophilic drugs हैं, they don't need BAC, they can really enter the cell. So those preservatives which are which make the drug molecule, अगर drug molecule छोटा हो, even then it can enter the cornea. It can penetrate the cornea without the preservative. Similarly, lipophilic drugs, they can enter the cornea without the preservative. फिर आप frequency of instillation, आप जितनी ज़्यादा frequency of instillation होगी, उतनी drug penetration ज़्यादा हो जाएगी, provided अगर उसका molecular weight छोटा है. अब unfortunately जो anti-glaucoma drugs हैं, they have a large molecule. So because they have a large molecule, they cannot enter the cornea. So they need higher concentration of BAC to destroy all the cement substance in the cornea so it can enter. That is why all anti-glaucoma medications cause maximum toxicity in the eye, cause maximum red eye, maximum loss of the tear-film. So all these patients who are on anti-glaucoma medication, they need supplementation of good lubricants, not the lubricant जिसमें के BAC हो, not the lubricant जिसमें के polyquad हो या quaternary ammonium compound है. जितने lubricants हैं which have polyquad, BAC or quaternary ammonium compound, they are hazardous to the eye. वो जो toxicity है वो anti-glaucoma drug से भी हो रही है और साथ आप lubricant भी वही वाला दे रहे हैं जिसमें के जी detergent effect है, तो वो toxicity तो maximum हो गई. But unfortunately, neither the medical reps know about this, neither the doctors. और वो धड़ाधड़ यही drugs दे रहे हैं जिसमें कि BAC भरा हुआ है. And this is very bad. तो मरीजों का हाल देखें फिर क्या होगा. So एक आँख, the drops, eye drop, how long it's going to stay on the cornea will depend. It's called the ocular residence time. How long an eye drop after installation will stay on the cornea. It depends upon how viscous the drop is, how thick it is. Number two, on the pH of the ocular surface and of the eye drop. अगर तो pH जो है इसका ocular surface जो है alkaline है, 7.5 है, तो वो eye drops तो रहेंगे. अब कुछ जो eye drops हैं, they are more acidic. Like जितनी भी antibiotics हैं, they are acidic. Anti-glaucoma drugs, they are acidic. So acidic eye drops, they are going to further aggravate the problem. Blink rate, अगर एक patient जिसको dry eye है, I told you it's blinking all the time. So blink rate से तो वो drugs जल्दी dissipate हो जाएगी and it will be out of the eye quickly. Evaporation rate, if it's the hot environment, उसमें भी जो evaporation जल्दी हो जाएगी. So this is pertaining to the lubricants. If you are giving lubricant और गर्मी का मौसम है, and you are giving out 3 hourly, 4 hourly, 5 hourly, and there is high evaporation rate, and it's an acidic ocular surface, or blink rate उस patient को already it's high, what good would an eye drop, which is instilled every 2 to 3 hours or after 4 hours, going to do in that eye? Nothing. Okay. So if the person has punctal occlusion, और उसके पंक्टे पहले ही ब्लॉक्ड हैं, तो अब क्या होगा जी, आपने एक ड्रग दी है जिसमें कि BAC है, वो ड्रग इट विल रिटेन ऑन द ऑक्यूलर सरफेस लॉन्गर टाइम, और लॉन्गर टाइम उसका साइड इफेक्ट. ऑन द अदर हैंड, हम जितने पेशेंट्स ग्लाकोमा वाले हैं उनको कहते हैं कि जी आपने पंक्टल ओक्लूजन करनी है ताकि ड्रग पेनिट्रेशन एनहांस हो. वो ड्रग पेनिट्रेशन एक्वस में तो चली गई, बट एट द सेम टाइम जो BAC की टॉक्सिसिटी है वो भी बढ़ जाती है. सो यू हैव टू बैलेंस कि आप कर क्या रहे हैं. सो दिस ये जो है HPMC, it stays on the cornea for only 45 seconds. Polyvinyl alcohol only 40 seconds. And this ये क्या है, What is SH? Anyways, so 45 to 40 seconds maximum जो है ये retention time है इन सारे eye drops का. So when you are instilling the eye drop, it's for us to tell them that look up, instill the eye drop, and the eye drop should go in the conjunctival sac. So normally it goes in the conjunctival sac, and then you occlude the punctum so it stays longer in the eye and it gets absorbed. कोई भी drug है, it absorbs through the cornea and through the conjunctiva and reaches the ocular inside, the inside of the eye. But जितने भी lubricants हैं, they are divided because of their composition, कि वो natural product है कि synthetic है. Natural जो है वो cellulose है, synthetic जो है वो दूसरे हैं. Then viscosity. Viscosity will determine the retention time on the cornea. And that retention time on the cornea is also dependent upon the temperature of the cornea. अब टेम्परेचर ऑफ द कॉर्निया कैसे जी, सर्दियों में कॉर्निया का टेम्परेचर कम होगा तो जो आई ड्रॉप है इट विल स्टे विस्कस, इट विल स्टे थिक एंड इट विल स्टे लॉन्गर ऑन द आई. गर्मियों में बिकॉज द टेम्परेचर इज हाई, सो दैट आई ड्रॉप अगर वो शेल्फ में पड़ा हुआ है, पेशेंट ने बाहर रखा हुआ है, वैसे ही गर्मी है तो उसकी तो विस्कोसिटी कम होगी. उसके बाद वो आंख में डाली गर्मी में तो गर्म आंख, तो वो तो वैसे ही विस्कोसिटी उसकी कम होगी, मेल्ट हो गया. और उसके बाद ब्लिंकिंग उसकी वैसे ही ज्यादा है तो वो तो हार्डली 15-20 सेकेंड it will stay on the cornea and it will get out. So when you are prescribing lubricants for dry eyes especially, all these lubricant bottles should be in the fridge always. Patient को आपको बताना है कि they should stay in the fridge and they should be put in the eye cold. A cold lubricant is going to be viscous and is going to stay longer on the cornea. Hope that's clear. Then pH. pH lubricant का it should be alkaline because dry eye तो already एक acidic eye है. उसमें आप अगर acidic pH वाला eye drop डालेंगे तो patient तो तड़प उठेगा. It will cause too much stinging and burning. So all these eye drops, like antibiotics, when they are instilled in a patient with a dry eye, they just scream with pain. वो कहते हैं जितनी मिर्चें लग रही हैं, burning हो रही है, because it's the eye drop is acidic and eyeball is already acidic in that eye, so it hurts. Then osmolarity, वो जो है osmoprotectors इसमें ज़रूर add वो कर देते हैं जो people who are making good lubricants. And osmoprotectors like carnitine, erythritol, and they help in maintaining the osmolarity. So the lubricants, they are high molecular weight and they are low molecular weight. Ab CMC or HPMC, yeah, carboxymethyl cellulose, they are high molecular weight lubricants. So the high molecular weight means they are more thick, more viscous, and they retain longer in the eye. But at the same time, they cause crusting on the eyelashes. So crust ban jate hain, and they may blur the vision during daytime, especially in winters. On the other hand, the low molecular weight, they stay for shorter time in the eye, but they are more helpful to patients जिन्होंने ज़्यादा पढ़ना है or who have more screen time. So the CMC, the cellulose derivative, cellulose is a natural product, and carboxymethyl cellulose and the HPMC, these are cellulose derivatives. So they are natural products, which is a good thing. Then there are polyols, and there is PVA, povidone, and sodium hyaluronate. So all these lubricants, different variety which are present in the market, they are made up of these products. And let's see their qualities one by one. Osmoprotectors, I told you, agar ek lubricant mein added hoga, which is glycerol, erythritol, and carnitine, they are excellent agents as they help in dry eyes. They prevent the cells from losing water. ये जो glycerol या erythritol हैं, they enter inside the cell and maintains its osmotic pressure so that cell stays in its normal size, normal shape, and it can function properly. It does not die. So these additives, they are added in allergen products which are sold in abroad, but not here, which is not good. So osmo protection, this diagram will tell you that on the top there is this dry eye, जिसमें कि there is loss of cells, और ये जो cornea जो है इसमें सारा ये globules ये बने हुए हैं, there is loss of water from that cornea. जबकि ये नीचे ये normal cornea, which is normal maintained, उसके जो collagen network है, the water content is normal. And then osmo protectors, lubricants are given with osmo protection. And gradually the size and the shape of the corneal epithelium or जो collagen lamellae हैं cornea के, they are maintained. So gradually they restored, they are healed. So that is the beneficial effect of osmo protectors, and they are excellent to be added into the lubricant. So now coming to the preservatives, BAC and polyquat and chlorobutanol, they are detergents. What do detergents do? जैसे कि ये हमारे the washing liquid है, surf है, ये जितने वो क्या करते हैं जी, वो detergent जो है वो सारा जो liquid, the oily thing है, it removes it. So all these detergents, BAC and polyquat, what they do is they remove the lipid layer of the tear film. They simply destroy it. जबकि ये oxidizing agents जो हैं, these are the vanishing preservatives. और उसमें the best is stabilized oxychloric compound or purite. What purite does is कि जब हम एक आंख में ये आता है, तो it separates from the active ingredient and it is oxidized in coming into contact with air, and it turns into oxygen and carbon dioxide. So oxygen to already required hai by the cornea. So it's a good compound. Similarly, sodium perborate, it is also a better preservative, as the borate ion jo hai wo antimicrobial hai, but it changes to water and oxygen. So making this preservative a bit safer, and a lot safer than BAC or polyquat. And then there are ionic buffers. So the worst kind are the BAC, polyquat, and chlorobutanol, but SOC, stabilized oxychloric compound, and sodium perborate, they are the better ones because they are not that toxic. So ideally, all the eye drops which are for the ocular surface, all the eye drops which are used for conjunctivitis, for corneal ulcer, for allergies, they all should have SOC or sodium perborate. They should never ever have BAC. All those drugs which have to reach inside the cornea and the aqueous, like anti-glaucoma medication or steroids, that's fine. Usme aap BAC dal dein, but in a lesser quantity, and ya phir aap polyquat dal dein in lesser amounts. But in amount of 0.5%, that is too much. That's too toxic for the eye. But all these drug companies, I mean, I don't know, they don't think about these things when they're making these. I hope this lecture can change a little bit. So the preservative toxicity is dose related. It's ocular surface pH related, ocular surface retention time, जिसमें कि punctal occlusion है. And then it's very important, अगर already एक damaged ocular surface है और उसमें आप वो वाली drug दे रहे हैं जिसमें कि BAC है या polyquat है. So that is insane. But I teach online and I have 250 students and I ask them कि जी मुझे वो drugs बताओ जिसमें कि polyquat और ये है BAC, which is used for ocular surface. They never even look at the bottles. Nobody looks at the bottles. कि इसमें हम क्या अपने मरीज को दे रहे हैं जिसमें already ocular surface damaged है. Nobody looks at, but I'm sure now people will start looking. So BAC, as I told you, it destroys the mucin glycocalyx layer. It breaks the zonular occludens. And these two pictures at the bottom, they show कि after ये normal corneal epithelium है, and then after 2 months or 6 weeks of using BAC, एक product जिसमें कि BAC था, well, there is total loss of corneal epithelium. पूरा area जो है उसमें ये the corneal epithelium has been lost. So this is the side effect of back. That is how it works. यहाँ पे corneal epithelium loss हो गया, लेकिन उसकी जो entry है into the cornea as well as into the aqueous is enhanced. And all these side effects, they are dose related. कि कितनी frequency में आप दे रहे हैं and for how long. जितनी duration होगी उसमें ये toxicity बढ़ेगी. So polyquid, it reduces goblet cells, conjunctival goblet cells and aqueous. Sodium perborate is good, SOC is good. And in terms of toxicity, सबसे toxic, thiamercel, फिर bag, फिर chlorobutanol, उसके बाद sodium perborate, EDTA, सबसे जो अच्छा है, that is SOC. So fortunately for you, Allergan, this is good, KG, इस जो आपकी ophthies है उसमें SOC डला हुआ है. So CMC, carboxymethyl cellulose, are methyl cellulose. These are all cellulose derivatives, and they have high retention time on the cornea. They are mucoadhesive. Mucoadhesive का ये मतलब है कि I told you कि mucin जहाँ पे dry eye होती है, there is loss of mucin. So these CMC and HPMC molecule, they have a negative charge around the molecule, and they adhere to that area जहाँ से mucin loss है. So they substitute, they are actually substituting loss of mucin, which is a very good thing. और वहाँ पे फिर they promote कि जब एक mucin होगी तो साइडों से the epithelial cells, they will come over and heal, and corneal heal, they promote corneal healing. So these three, the higher retention time on the ocular surface, mucoadhesiveness, and they stimulate epithelial cell migration and healing. These are the extremely plus points of CMC and HPMC. So of these, it has got SOC in a minimum amount, which is 0.0075. I mean, you're all here, all the Allergan people and Barrett Hodgson. This is not mentioned either on the bottle or on the leaflet, which is such a good point. If you all know why your product is better than the others, it's a plus point for you to promote it. But unfortunately, your big boss, I mean, he has declared this is trade secret. This is not a trade secret. You all should know that it has SOC, which is a good preservative, and it is in a very less concentration, which is 0.0075. Number two, it has got electrolytes in it, which is very good. And it is mucoadhesive, which is excellent. So all these three components make Opthes a very good drug. So it can be given in mild, moderate, as well as severe dry eyes. Another is sodium hyaluronate. It is a glycosaminoglycan. It is an excellent viscoelastic with water retention properties. And again, it supports epithelial healing as well as it is antioxidant. Or there's Refresh Tears, I think, which is also a product of Allergan. These Refresh Tears, they have a combination of CMC and sodium hyaluronate. So that makes it an excellent lubricant. But unfortunately, I don't think it's available here. Is it available here? Refresh Tears? Dr.
No.
Ali, is it available here? No?
No, ma'am, no.
Yeah, it is an Allergan product, isn't it?
Yes. It is available with the name of Opthes SAM formulation.
No, Opthes does not have this sodium hyaluronate. It's only CMC.
Yes.
Opthes does not have sodium hyaluronate. But Refresh Tears have, in addition, sodium hyaluronate. So you should try to get it here for Pakistan as well. Then Povidone, there are many products, lubricants, which have added Povidone in it, like your Tears Plus. Povidone, what again it does is, it is a mucinomimetic. It mimics mucin. So I told you mucin is so important for dry eye patients. So addition of Povidone, increases the retention time of the lubricant, as well as its adherence to the damaged cornea. So this Tears Plus, it has povidone in it, which makes it a good product. This HP hydroxypropyl guar. Now, what it does is that the cysteine. Now, I mean, cysteine is extremely popular with all grades of ophthalmologists. I don't know why, but unfortunately, they don't know that cysteine or this hydroxypropyl guar, what it does is it is pH dependent. At pH of 7.5, which is the normal pH of an eye, it makes a gel, a network that stays on the cornea, or usme phir it retains the water. So for a normal eye, this hydroxypropyl guar is excellent for a normal eye. But in a dry eye, it's an acidic pH. This network gel, it will not form an acidic pH. It does not form in an acidic pH. So any patient who has moderate to severe dry eye, cysteine does not work. It cannot work. So I hope you can convey this message to your doctors because it is pH dependent. Tears Plus, I told you it's got iska ye jo preservative hai, that is also chlorobutanol 0.5%, which is a bit high. It could have been reduced a little bit more, so iski efficacy aur badh jati. So for mild dry eye, Tears Plus is good because it's got added povidone in it, which is mucinomimetic, and it's got hydrophilic properties. So if in your meeting or whatever, you can reduce the level of chlorobutanol a little bit more, that would make it even more tolerable and patients will be happier. So how to select a lubricant? Now, as I told you, frequency जो है जी वो तो retention time पे है. अगर during day आपने देना है, so it should be an eye drop. Agar to severe dry eye hai, it should be more viscous, which is of course with CMC or HPMC. If it's mild dry eye, so CMC or HPMC, it blurs the vision a little bit. Particularly agar uski concentration 1% se zyada hai. So 1% फिर भी tolerable है, 0.5% एक mild dry eye में you can give, but 1% concentration जो कि ophthalmology की है, it's good for moderate to severe dry eye, but mild dry eye patients or patients जो कि ज़्यादा इनका screen time है, जिन्होंने पढ़ना ज़्यादा है, उसमें it causes a bit of blurring of vision. So उसमें फिर आप Tears Plus उनको दे सकते हैं. So ointment must be, any patient who needs lubricants must be prescribed ointment at night, which is your Lecrelure. And frequency has to be every hour. अगर एक patient को lubricant चाहिए और वो 4 दफा दिन में डाल रहा है, what good is it achieving? Nothing. 4 घंटे बाद या 6 घंटे बाद एक lubricant कुछ नहीं कर रहा. If a person needs lubricant, it has to be every hour or 2 hours max. Otherwise, it's the hakima, वो बिल्कुल हकीमा वाले use का नुस्खा. So, और अगर severe dry है, then it has to be preservative free, जो कि बहुत मुश्किल है मिलना. So, and addition of lipids in products which are sold allergen abroad, they have these oil added to them. And there are, in other countries, there are products available, lubricants, which have lipids added as well. So they are excellent. And castor oil, it's an amazing drug. If it's added to the lubricant, it enhances the retaining properties. So autologous serum is the ideal lubricant. Second best is with CMC, and in severe dry eyes, must add anti-inflammatory therapy because lubricant alone will not treat the dry eye. ठीक है जी, that ends our lecture. So any questions?
Thank you so much, ma'am, for your informative presentation. There is some question from the participant. First question is from Nabil Nawabshah. If there is a glaucoma patient and we're using anti-glaucoma treatment, so what is the role of lubricant in that patient who is in anti-glaucoma treatment?
I just answered that anti-glaucoma treatment, all anti-glaucoma drugs, they are with BAC and with high concentration, 0.5%. So if number one, you should choose wisely. Even at pressures of 20, 22, 25, patients are getting 2 or 3 anti-glaucoma medication. Why? I mean, all the doctors are writing anti-glaucoma drugs. Why? Bhai? You teach them, KG, use one drug at 25 pressure or even 27. Use one drug, and then you teach them properly how to instill the eye drops with punctal occlusion. So that one eye drop will work, rather than you give 2 or you give 3 maximum number of eye drops, and they are just going to kill the ocular surface. So, I mean, why are they doing that? So all the doctors, they need to know, number one, to prescribe minimum number of anti-glaucoma therapy. Number 2, to educate the patients the proper technique of instillation of eye drops. So instill one drop and then do a punctal occlusion for 30 seconds. So that one drop will work. And rather than adding another 2 and 3 and 4, some patients are on 4 drugs. And then you add lubricants. Other important point about these anti-glaucoma drugs is that they should not be allowed to fall on the skin. I told you, KG, all these anti-glaucoma drugs, they have high molecular weight, 5,000 Daltons. That high molecular weight, it causes severe eczema on the skin, severe. So any patient, एक तो वो उसको bottle को squeeze ना करेगी कि 10 कतरे उसमें से निकल रहे हैं, and those 10 कतरे are falling down on the skin and causing eczema. Just hold the bottle and let one drop fall, and then do punctal.
Thank you so much. Ma'am, there is another question. Lubricant can alter normal tear production if given more than 2 weeks.
Lubricants are not going to alter the tear production. That tear production is going to improve only and only with the anti-inflammatory therapy that you are going to get. Lubricant is only just replacing you, buying you time that healing occurs of the lacrimal gland, of the Meibomian gland, of the conjunctiva to release mucin. Lubricants are not doing anything else. They are not going to replace the secretion. The secretion you have to enhance by anti-inflammatory therapy that I told.
Ma'am, there is a permanent treatment for the dry eyes other than supplements?
Permanent treatment, of course, you improve the production of aqueous, mucin, and meibum. And that permanent treatment is tacrolimus and cyclosporin, anti-inflammatory drugs, as well as this acetylcysteine. All these 3, they act together and improve the secretion of all 3 components of the tear film. And in addition, you support the tear film by lubricants. So unless anti-inflammatory therapy is given, all these 3, and then Schirmer's and tear film breakup time is assessed every month, with lubricant alone are not going to do anything.
Ma'am, and there is another question. Can opthes be used in hyperemia and congestion? If patient
Yes, why not?
To prostaglandins.
Yeah, it does. It has the minimum amount of the good preservative, the better preservative than all the other products. SSC is mildest and in lesser concentration.
Dr. Ali?
Any other question?
Rashi sir?
कोई और क्वेश्चन है?
No sir, no sir.
अच्छा, डॉक्टर साहब एक क्वेश्चन या एक चीज मैं शेयर करना चाहता हूँ अपनी टीम के साथ भी. since there is a lot of cataract surgery is going on in Pakistan and the lasers usage in Pakistan, so say कोई भी trauma जो है is causing dry eyes, I believe. So इसमें actually I'm talking about the usage of any artificial tear post cataract surgery. So what do you believe कि हमारी ऑप्टीज post operative दी जा सकती है?
Absolutely. I mean, I just told you, cataract surgery, it alters the balance of tear production because of pre-op medication, intra 6 weeks. So all these patients, they need pre-op assessment, must by the surgeon. वो press करें कि जी इधर से कि माइबम सही बन रहा है, and then they must stain the cornea कि उसमें already tear aqueous deficiencies नहीं है, and do the shimmers, and then pre-op इनको lubricant शुरू कर देने चाहिए pre-op, and post-op तो must है वैसे ही.
Thank you, thank you. Daniel,
And as
over to you.
For LASIK patient, for PRK, the lubricants must be continued for 6 months. Shouldn't be stopped before 6 months.
Dr. Ali, do you have any question?
No, but I would like to thank you to give that you gave a very valuable time from your busy schedule, and it was a very extremely learning session. And Dr. Madam Sameera Irfan, I would request our Director Commercial, Mr. Rashid Bodla, to present his sentiments and closing remarks for this session.
Sir. Thank you very much, Dr. Sameera, sharing your much valuable time for me and my team. And I'm grateful on behalf of myself, my team, and my company for imparting such a great knowledge. And I advise to all of my team members to learn what of these is and what dry eye is. And at the same time, I would like to share with you, Dr. Sava, that because of your trust and confidence on not only on Ophthes, on all the range of my product, Allergan Barrett Hodgson is #1 ophthalmic company, as well as the size is concerned in Pakistan. And this is really very prestigious moment for me that a person like you is sharing your much valuable talk and experiences. And I used to share your personal experience of your daughter usage of these instead of sustain after doing this laser surgery from Dr. Hashmani. So, and at the same time, we have a very good response despite of this fact that we are sharing not accurate knowledge as you have told us now with the public at large, I mean with doctors in Pakistan. So hopefully मैंने और मेरी टीम ने इसको आगे इस मैसेज को और इस लर्निंग को शेयर करना है. और डॉक्टर साहब लास्ट बट नॉट लीस्ट अगर कोई और चीज भी सीखनी हुई तो हम आपसे जरूर रिक्वेस्ट करेंगे. थैंक यू वेरी मच again and again. बहुत शुक्रिया डॉक्टर.
Thank you so
Over to
much.
Daniel.
Thank you so much for inviting me. And
Thank you so much, ma'am. Thank you so much.
Okay, ji.
Dr. Saab, bye bye.
Okay, ji. Allah Hafiz. Thank